Every day, healthcare professionals fight to keep patients healthy, but there's another battle we don't see, a battle against cyber threats. Welcome to Cyber Survivor. In each episode, you'll hear from the doctors, nurses, IT leaders, and administrators who have faced these threats head-on. Their stories aren't just about cyber attacks, they're about resilience, innovation, and the unwavering commitment to patient care. Because in healthcare, cybersecurity isn't just about protecting data, it's about protecting people. So good morning, Dan. It's good to see you again. I haven't seen you in a couple of months. You were with Rich Helpy with his podcast. I really liked the episode that you recorded with him for The Common Bridge because it opened up a lot of doors. What were some of your thoughts as to what an audience would appreciate about the world of cybersecurity now? And tell us also a little bit about who that audience would be.
Yeah, when I think about cybersecurity and healthcare, it's having such a profound impact on the human side of healthcare, right? I mean, at the end of the day, we're all patients at some point or no patients. The workers within healthcare organizations, the clinicians, the administrators, people also are oftentimes think about, cybersecurity and IT and what the impacts are there. But some of these attacks are having a massive impact on, the clinicians and certainly the patients. And so what we thought was, let's create a platform for what we're calling survivors who have been through attack on a healthcare organization, have lived through, the world's worst day, have recovered from that. And so we want to let them tell their stories and let us understand their experience. So hopefully we can all learn from it and create a safer healthcare ecosystem for all of us.
And that sounds great. So I'm hearing the title in there, Cyber Survivor. I like that. Do you want to expound on that a little bit? I heard you say that let's talk to somebody at the end of the day as it goes. How did that work out for you? And what were some of the struggles? Do I have that down about right?
Yeah, I think so. I mean, look, I don't think anybody wakes up in the morning and wants to live through a cyber incident, whether you're in IT or the CEO of a health system for sure, or a patient, but you're faced with this situation that you have to navigate. And we believe very strongly that when you're on the other side of that, you've survived something that was material, that impacted you. And so we want to learn from that. And so we think you're a survivor. And, for some of our guests, we will keep them anonymous so that they can feel comfortable talking about the impacts, hopefully, again, through the lens of other people learning from what they experienced so that we can all get better.
So my wife is a professional and my son's a physician. So they both kind of went through this in the past year or so, my wife being a manager with Ascension before they merged with Henry Ford. And those were some pretty intense days and weeks for us at our house. And she was 24/7 somewhere. She is in charge of a lot of the pharmacies around that network. So I know of what you speak. Do you see this increasing in the last few years? Are you seeing this ramp up, more and more cyber attacks? How do you see that going right now?
Yeah, absolutely. I mean, unfortunately, we're launching this podcast in a macro environment that is just increasing the sophistication of attacks. And we're seeing more detrimental, longer downtimes. I mean, that was really the aha moment for me on this podcast was, if you look at the adversaries, they're attacking healthcare because they know that healthcare has to get back online quickly. And so they're likely to pay. But in that period of time where systems are down, the clinicians are very handcuffed on their ability to deliver care and coordinate care. And so, again, we want to walk around those experiences and learn about the human side of those impacts.
It was incredible, at least from what I was seeing with what was going around in our household and my wife and such. All the pharmacies, for instance, had to go to paper. And all of a sudden, she had a lot of pharmacists and pharm technicians and stuff that were just trained on software. And it got down to doing math. I mean, straight down to math problems. And that was interesting. And that's just a tiny, tiny piece of it. I remember during your interview with Rich, there was an underlying, and you're very measured, which is great in this profession, but there was an underlying, at least me as an engineer listening to that interview, that it's a lot scarier than we think it is. That the companies like what you're doing are really the only barrier that's kind of helping this right now, or at least identifying it. Do you see that as being a truth, or did I overestimate? I was scared. Some of the things you were talking about.
Well, look, my intention certainly wasn't to scare you or anybody. I think it certainly got national attention. I mean, there's a lot of activity in DC as an example, trying to figure out how they get regulatory supports, funding supports, those types of things. Because I think the world recognizes A, the importance of healthcare, and B, now the impacts that a cyber event can have on that. Right. And again, I always go back to healthcare organizations exist to deliver care within those communities. And so anything that can disrupt their ability to deliver care, whether that's a natural disaster, a snowstorm, or a cyber event, you need to be prepared for that, right? And we need to learn from others that have been through that before. And so that's part of the desire of this platform. And my hope is to, again, yes, we will certainly have IT experts and cyber experts share their experiences, but we want to walk all the way around the healthcare ecosystem and hear from people in the C-suite and people that are in rev cycle and people that are in clinical management or billing or all of the facets so that we can truly understand what are some of these impacts and how is it affecting the ability for that organization, that hospital, if you will, to deliver care in the community, which is really what they're there to do.
That's interesting. Do you see this as being more of a solutions-based discussion or more of an effect-based podcast? I can understand that a listener would go, this is fascinating to hear the trouble that this individual or this individual's department or this hospital went through. What do you see as the message that's being sent out episode to episode on this?
Yeah, so my hope is that each episode will focus on a particular, individual that survived a cyber event, and we'll start by understanding what does a normal day look like in your role, whether you're in administration or in IT or in clinical care, what does that look like? And then how did you find out about the cyber event and what did that day look like? How disruptive was it for you? And then the third part we'll look at is, okay, how did you recover? What changed? Did your organization do anything that you noticed? And I think depending on who we're talking to, those changes could be small, could be nothing, could be big. And then ultimately, we're going to try to wrap the whole conversation at the end around what was the impact to patients? What can we be doing going forward as an industry to make sure that we're enabling these organizations to deliver care in these communities?
We're going to take Ascension as an example, but let's say an Ascension-like situation. Do you think that even though cyber attacks, that wasn't the first one by far, but do you think that those organizations or organizations like that are still blindsided the day it happens to the point that there's still a scrambling stage instead of a process stage? Okay, here's what happened, here's how we're going. Do you think it's still oh my God, what do we do?
I think it varies by organization. I think we've made progress as an industry in having a disaster recovery plan, having an incident response plan. We've certainly made progress in that. But look, there's a surprise, and every one of these is different. The impact's different. So therefore, the response is a little bit different. We also don't talk a lot about, and we will on the podcast, but there's like little incidences that happen, right, that are kind of minorly disruptive. Not everything takes you down for, weeks or months. We'll certainly explore those as well. But what are some of the littler ones? And then how are we responding to it? So we'll look at different size impacts as well.
Do you see that the processes and solutions that will be talked about on this podcast, do you see them having any bleed over into any other industries? Or am I looking at that maybe outside the vertical and that's not where you want to go?
Yeah, I mean, I think there's certainly going to be applicability in some elements of it. I think what we're going to try to focus on specifically are some of the healthcare specific impacts around the delivery of care in these communities. And what's the human impact? Because like one thing we haven't talked about is, these cyber events are happening in the backdrop where we have nurse shortages, right? We have staffing issues. We operate on grocery store margin budgets. We've probably underinvested in various areas within the hospital organization as they try to balance all of the needs of the community. And so, these are massively disruptive, right? And so we often hear about, physician burnout is a big topic in healthcare. I'm tired of always having to go home and chart on my, electronic medical record, and now I can't even access it, so I can't deliver care. I mean, some of these things are just unique to healthcare. I'm sure there will be things that could be pulled out for other industries, but predominantly it'll be a healthcare focused podcast.
It's interesting that you say just that, because my son, he comes home and does his charting at home sometimes after he's a second year resident. That shut down. It just shut down. So all of a sudden that becomes an issue for him as paperwork. And as I said before, my wife with all of her pharmacies, I think she has 12 or 13 of those, and that became a paper thing. So I know of what you're talking about, and I'm not in your industry. I just watch it from the outside. So I think it might be very, very interesting for a lot of audience members who might be outside of that industry to still tune in and go, oh my goodness, this is both interesting. I see that there's solutions out there, but it maybe gives an audience member who's not in the healthcare industry a look to the inside, and maybe it's comforting, maybe it's not. What do you think it would be to expand the audience outside of your industry?
Yeah, I think the audience, look, I've been thinking about this for a couple of years, and I've talked to a lot of people about this concept of bringing some experiences in a podcast format. And I agree with you that I think lots of people will be very interested in this. We've certainly seen some of the national media talk about this, the local media, certainly if it's disruptive. So I think there's a general understanding of, oh my gosh, hospital XYZ has a cyber event, care is disrupted, and people want to know, what does that mean? How does that happen? What is the impact? How long does it take to recover? And so I think there'll be an interest quite broadly to learn a little bit more about that. And I think some of these conversations, especially with some of the guests, we'll talk about some of the solutions that we're doing, right? And again, I think it would be nice to balance the big events, but we'll also talk about some that we stopped and prevented, right? That maybe one laptop was shut down, but we could still deliver care because we had put some, defense in depth within that organization, and we were able to successfully not disrupt care. So I hope to attack that angle as well.
That sounds fantastic. Is there anything that you would like to tell your people and or a different audience that we haven't covered today?
The last thing that I would say is, we are launching this podcast during Patient Safety Week, because at the end of the day, we're all patients. And this is important to make sure that everybody understands how cybersecurity can impact communities and care, so that we can learn from each other and ultimately strengthen the cybersecurity posture of healthcare.
That's great. Well, thanks a lot for your time, and good luck with this. I think it's going to be an amazing podcast and be really informative. Thanks a lot for your time today. I think this has been great.
Yeah, absolutely. Really appreciate it. And thanks for the support. We're excited.
Thank you for joining us on Cyber Survivor. If today's story resonates with you, share it. Awareness is the first step towards stronger defenses, and together, we can help protect the future of healthcare. After all, we're all patients.